So today we're diving into an infection that, it kind of operates in silence, but wow, it can have some serious lifelong consequences. It's a really common STI, but its hidden dangers go way beyond what most people think.
All right, let's just get right to the heart of it. This is the big question, and it might sound a little alarming. Can this very common infection actually stop you from being able to have children? And the answer, when you look at all the medical evidence, is a pretty clear yes. If you don't treat it, gonorrhea absolutely can lead to infertility, and that's true for both men and women. So, how on earth does that happen? Okay, let's break this down. First, we're going to talk about why this infection is just so sneaky. Then, we'll actually trace its path up through the body. We'll look at exactly how it messes with fertility, explore some other complications, and then, and this is the important part, we'll talk about the solutions, which are actually pretty straightforward. So our story really begins with the core of the problem. Gonorrhea is super common, but it often flies completely under the radar. The culprit is this little bacterium, Neisseria gonorrhea. But the real danger isn't the bug itself. It's the fact that the infection is often completely asymptomatic, especially for women. I mean, you can feel totally fine, have zero clue it's there, while it's just silently causing damage. And this is where that silence becomes really dangerous. For about 10 to 20% of untreated infections in the cervix, the bacteria don't just stay put. Nope, they start to climb, moving up into the upper reproductive tract. And that is where the real trouble begins. So let's actually follow that journey. We're going to see how a pretty localized infection can escalate into a major health crisis if it's ignored. Okay, so it all starts at a surface, like the cervix. From there, the bacteria travel up into the uterus and, this is the critical part, into the fallopian tubes. This journey triggers this massive inflammatory response, a condition known as salpingitis. And all that inflammation is what leads to something called pelvic inflammatory disease, or PID, and the tissue damage that comes with it, which, by the way, is irreversible. Now, here is a wild and really important detail. The real harm, the damage to those super delicate cells that line the fallopian tubes, it isn't actually caused by the bacteria directly. It's caused by our own body's defense system. The bacteria basically trick our body into releasing this powerful inflammatory molecule, tumor necrosis factor alpha, or TNF alpha, and that stuff is actually toxic to our own cells. You see, the bacteria have these little components on their cell walls. You can think of them like tiny alarm bells. When your immune system spots them, it sounds this huge 5-alarm fire and just unleashes all these destructive molecules like TNF alpha. So the takeaway here is really this. It's basically a case of friendly fire. Your immune system is trying so hard to fight the infection that it just overreacts. It launches an attack so powerful that it ends up damaging your own tissues, and that leads to scarring and permanent harm. And all of this brings us to the most devastating consequence of that internal battle, the direct threat to your ability to have children. Pelvic inflammatory disease is the direct result of that upward spreading infection and inflammation. And this isn't some mild condition. We're talking about a really serious infection of the reproductive organs that can cause damage that you just can't undo. So the damage looks a little different from men and women, but the outcomes can be equally severe. For women, PID causes scarring that can literally block the fallopian tubes. That makes it impossible for an egg and sperm to even meet. It also dramatically increases the risk of a dangerous ectopic pregnancy. For men, the infection can cause something called epididymitis, which is a really painful inflammation of the tubes that carry sperm, and that can also lead to blockages and fertility problems. And just to put the impact on female fertility into perspective, this kind of damage, which doctors call tubal factor infertility, is a huge issue. It actually accounts for around 30% of all infertility cases in women, and infections like gonorrhea, they're one of the main causes. But believe it or not, the damage isn't always stuck in the reproductive system. In some rare cases, this infection can actually break out and travel through your entire body. It's called disseminated gonococcal infection, or DGI, and it happens when the bacteria manage to escape the initial infection site and get into the bloodstream. And once they're there, they can travel anywhere and set up shop in new places, like your skin, your tendons, and especially your joints. Now, it's really important to say this is not common. It affects, at most, about 3% of people who get gonorrhea. But for the people who do get it, the consequences can be incredibly severe and really, really painful. DGI usually shows up in one of two ways. You might get the arthritis dermatitis syndrome, which is this painful trio of inflamed tendons, skin rashes, and joint pain all over. Or it can show up as septic arthritis, where one or more of your joints, often the knees, ankles, or wrists, become incredibly painful and swollen with pus.
Okay, after all of that pretty serious news, I really want to shift our focus to the most important part of this whole story. Because despite how severe all these complications are, there is a clear, effective solution.
This right here is the single most important thing to remember. Gonorrhea is curable. The bacteria can be completely 100% eliminated from your body. And the path to getting cured is really straightforward. It takes antibiotics from a doctor. Let me be clear, home remedies do not work at all. Getting tested is easy. It's usually just a simple urine test or a swab. And most importantly, getting care is accessible. You can find low-cost or even free testing and treatment at places like public health clinics, student wellness centers, Planned Parenthood, and LGBTQIA+ centers. So here's the bottom line. Every single severe outcome we've talked about, the infertility, the ectopic pregnancies, the body-wide infections, all of it is preventable. If you catch it early and get treated with the right antibiotics, you can stop this infection long before it ever gets a chance to cause permanent damage. Which really just leaves us with one last big question. If this is all entirely preventable, if we have the science and the tools to stop all of this from happening, what stops us? Is it stigma? Is it a lack of access to healthcare? Or is it something else entirely?